My name is Helen Adamson. I am the Associate Professional Lead for Diagnostic Radiography here at the University of Bradford. Today we're going to be talking about the Fujifilm 128 Scenaria View CT scanner, and we're going to be talking about some of the key features in terms of patient safety on the scanner and the software. On the CT scanner, first of all, what we have is some touch pads on the top and the bottom, and you can customize it to get them on the side of the CT scanner as well. And the purpose of these pads is that if you have an uncooperative patient or a patient that is moving about in the scanner, if they touch the safety pads, it will cut out the scan straight away. So the benefit of this is that actually it will stop the scan from occurring, so you're not doing giving an extra radiation dose to the patient, because it will be undiagnostic because the patient is moving. But it also means that the scanner will stop moving, and so the patient won't get their arm trapped or anything like that either. Some other features on the scanner: the table goes down to the floor. It's about 9 centimeters off the floor, which is really low for the CT table to move. A lot of manufacturers don't go that low. So that's great for patients who are overweight and obese, but also for patients that really struggle with mobility. Being able to move the table that low helps us get the patient comfortable on the scanner without too much moving and handling ourselves. Often when you bring patients in for a CT scan, say it's the first time they've had a CT scan, you go through quite a lot of instructions to explain to the patient what it's going to feel like for them laid on the table, the way in which the table will move, what's going to be involved in that CT examination. And so on the Scenaria View CT scanner, there is a little instruction video as well, so it's got some helpful visual cues. So for people who are more visual learners or relate more to visual information, this is a really good way to help get that information across to patients so that they know exactly what's going to happen for their scan and they feel much more confident about that. So on the Scenaria View, there is a screen on the front which displays a video it's an animation of a cloud which changes into different objects. So there's like a fork, there's a whale, there's an ice cream, and then there's also 2 videos inside the CT scanner, one at the front, one at the back. So this is really useful for pediatric patients to keep them still, and they've actually got something to watch and distract them, so it's not as frightening for them to go into the CT scanner. But these animations can also be used for patients that might have learning disabilities or learning differences, and even as a distraction tool for patients that might have Alzheimer's and dementia as well, because it gives them something else to focus upon rather than seeing themselves moving into the centre of the scanner.
My name's Gareth Eyeball. I'm a medical physicist by background. Now I'm working here at the University of Bradford. I'm an Associate Professor of Diagnostic Radiography. Iterative reconstruction is like the standard method for reconstructing CT images. We used to use a technique called filtered back projection, but now iterative reconstruction is a better technique because it's more radiation dose efficient, so it allows us to get better image quality at the same radiation dose. But one of the problems with iterative reconstruction historically has been that the radiologists who are looking at the images, or maybe radiographers looking at the images, find the images just look different from how they used to. They can be a bit too smooth, they can be described as a bit plasticky or waxy, and that can affect the confidence in the images. What's really great about the Fujifilm iterative reconstruction system that's called IntelliIPA is it doesn't change the feel of the image at all. So we can look at how noise is presented in the image, and that's something called a noise power spectrum. And on a lot of scanners, there's a shift in that spectrum when we use iterative reconstruction. But the Fujifilm system makes no change to that. So what that does, it allows us to have really good quality images at a low dose, but also it really gives the radiologist looking at the images the confidence that the images look how they used to, and really helps them to have confidence in their diagnosis. The radiographer will position the patient on the scanner, and the first thing they'll do is undertake some planning scans that are called scanograms. Once they've done that, they use that scanogram to plan the full, we call it helical acquisition of the patient. When they do that, they're often going to use a system called automatic exposure control, and the reason that's used is to produce images with a defined level of image quality. On the Fujifilm system, that software is called IntelliEC. It allows the users to say, I want this level of image quality, and then we're confident the system's going to deliver that for us. But when they've acquired that planning scan and set the length of the patient they want to scan, the system will show us a graph of how the MAS is going to change along the length of the scan. And it's really clear visualization of what the scanner's doing. So it can give the radiographer real confidence in knowing I've asked for a certain level of image quality, I'm going to get that, and this is how the scanner is going to adjust the dose to deliver that. So it's a really helpful way of the radiographer being really clear what the optimization of the scan is. They know the image quality they're getting, they know how the scanner is going to adjust the dose. And if they see anything is not quite right with that MAS graph, maybe it's hitting a ceiling level or bottoming out somewhere, they can just go into the scan protocol and adjust that, and they instantly see those changes to make sure that the patient's getting the right dose and therefore the right level of image quality as well.
On the Scenaria View CT scanner, it has lateral table movement and it moves from 9 centimetres on both sides. So that's quite a wide range to be able to move your patient. The reason why you need this lateral table shift movement is to achieve better positioning of your patient so that the patient is within the isocenter. And it's really important that we position our patients in the isocenter, isn't it, Gareth?
That's right, Helen, it's really important. We always teach the radiographers to make sure the patient's well positioned in the center of the gantry. And often what that means is we're getting the best image quality towards the center of the patient. But if we're trying to image maybe the shoulder, and that would be away from the isocenter, what the lateral shift gives us is that ability to move that anatomy of interest right into the center to make sure we get the best image quality actually in the part of the patient we're really interested in.
And if you don't have that lateral table shift movement, what you often end up doing is having to physically move a patient, and it's quite uncomfortable for the patient. It's difficult for you as the radiographer as well, with that moving and handling, that manual lifting of patients. But being able to just use a button and adjust the patient side to side is fantastic.
So as a medical physicist by background, I've worked with a lot of different manufacturers' CT systems over my 25-year career in the NHS. And when I first came to use the Fujifilm scanner, I was just really impressed as to how easy it was to use. When I looked at the patient registration and the scanning screens, I found just a really logical flow to information, and it was clear where different parameters were, clear how I could make adjustments, and I found the scanning and reconstruction really, really straightforward. Much easier than on some of the systems I've used historically. I think it's a very user-friendly system.